o'clock this morning. So let's give it a minute for people to hop on. I see these names coming in. I want to say hi to everybody. Oh my gosh. Just some fun people on this call. All right, why don't we go ahead and get started? I know more will be joining us. Chase, is it looking clear? Or can you tell?
Go ahead.
Okay, let's go. Well, good morning. I'm Lyle Hanna. Just delighted to host you all today for our Crisis Management for COVID-19 Phase 51. We've done a lot of these since March of 2020. We're glad you're here today. We've got a great program for you. I think we'll wrap up in about an hour, but we're going to be really moving through some stuff quickly to make that happen. Of course, Jim Morris is back, and I've got some exciting news to share with you about that and about Jim. And but we also have two other special guests. Is that Jim laughing and coughing in the background?
That's just me laughing.
Yeah, I'll have a special presentation for Jim in just a minute. But we have two other guests that I've asked to join us just because I know everybody is struggling with what's going on in the work and how to manage stuff. And I guess one thing I thought is I'd like for you all to know you are not alone if you're facing challenges. And so two guests that are going to just give us a brief overview of what's going on in their workplace. One is Susan Simmons. She's the Executive Vice President and HR Director at Central Bank. And she's not new to this job. She's been for quite a few years. And before that, she had a similar job at First Federal Savings in E-Town. So I think she resides in two cities now, sometimes here and sometimes there. But really, she has done a great job across the state being active. She actually started their SHRM organization in E-Town, and she's been on the state SHRM Council for many years. Had a lot of big jobs. In fact, even at she's the past chair of the Kentucky Chamber's Workforce Center Board. So, Susan, we're just delighted you're here. And let me just say a word about Karen Venus, because she's here too, and what a ball she's wrestling with right now. Karen is the CEO of Sayre Christian Village. And Sayre Christian Village has almost 500 residents, and it's a great facility. I'm excited because we actually helped hire her back, 10 years ago as the head of HR. So those of you, well, it's 12 years ago, wasn't it? 2010, head of HR for that facility. And now she has risen to the top job. And boy, oh boy, she got her hands full with some challenges. So we're looking forward to hearing from both of them. Susan, we're going to let you go first. And then we'll jump on to some of these other things. Here's kind of what all we're going to cover today. Yeah. How are business handling Omicron? So that's what these two guests are going to share with us. And then we've got some Kentucky COVID statistics. And oh my gosh, the numbers are sky high, as you could expect. And then Jim's going to give us an update on the legal and regulatory changes. So let's jump on in. And Sharon, Susan, why don't you give us a start?
Right, thanks, Lyle. So first I was going to talk about staffing, and early in the pandemic in 2020, just to hear that someone in the workplace had COVID struck terror in everyone around them. But our internal cases were so low that year that staffing wasn't really a problem, and we all believed that this would be over within the year. Here at Central Bank, we typically hire in classes of 8, 6 times a year, but our training rooms didn't allow for us to conduct classes while maintaining safe distances. So, like many others, we put hiring on hold. And once we saw that this COVID thing was going to last more than just a few months, we converted one of our large conference rooms into a training facility with a computer at each 6-foot table and spaced them throughout the room so we could start hiring again and keep everyone well distanced during the training. That was in August of 2020. We had 2 more hiring classes that year, but among the 3, we were only able to bring in a total of 22 people where we normally would have hired 50 by then. And we found we were digging out of what had become a pretty deep hole. We were fighting to catch up throughout all of 2021 due to the limitations in class sizes, as well as finding qualified applicants willing to come into the workplace. And we had a slightly higher turnover than normal years in 2021. It was a little over 16% versus 10.7% in 2020 and 9.8% in 2019. The industry average for banking is 19 to 23%. So in comparison, we did well, but for our internal levels, it was pretty impactful. And now with the Omicron variant, our number of employees out of the office have skyrocketed in January. I've not seen anything like it. In the entire year of 2020, we had 40 cases spread out among our 26 locations. That's for the entire year. In 2021, we had a total of 94, again for the entire year. In the month of this January alone, we have had 66 positive cases, and we still have a week left in the month.
Wow.
So it's just been overwhelming. Some of our branches have had to go to drive-through service for a week here and there. The reduction of days required to isolate, though, has helped a great deal. And with our vaccination level at 85%, we haven't had to quarantine very many coworkers when a positive case occurs. So we're completely operational at all locations, but we never know what could happen from one day to the next. So that's where we are on staffing. And as far as masking, we don't currently require everyone to mask. We have anyone who is tested positive to wear a mask for a minimum of 5 additional days once they are cleared to return to work. And anyone who has been vaccinated and exposed to a positive case is to wear a mask for 5 days as well. Anyone who hasn't been vaccinated must quarantine following exposure and then wear a mask for 5 days when they return. And then we have several who choose to just wear a mask for their own comfort, regardless of vaccination status. We were really prepared for the testing requirement for large employers in the event that the OSHA emergency temporary standard was upheld. However, I had a handful of employees say they would have chosen to quit over weekly testing as a matter of principle. And we're very thankful that that did not become a reality. So our employees know to test upon experiencing symptoms or anytime they know they've been exposed and are unvaccinated. We recommend that vaccinated employees get tested following exposure, but it isn't mandated unless they become symptomatic. And we regularly encourage getting vaccinated and required everyone to submit their vaccination status to us in preparation for the OSHA mandate. And as I mentioned previously, we're thankfully vaccinated at 85% overall. That may change if having the booster becomes part of the definition of being fully vaccinated, as I understand it most likely will. And that's where we stand today.
Wow. Thank you, Susan. Appreciate that. A lot of stuff, crazy stuff going on, and I'm glad you made it through so far.
This month has been pretty rough.
I hear you. Wow.
Hey, Lyle.
Yes.
The question that just got posted might be great for either Susan or waiting until both have spoken and then both of them. But they just posted a question of, how are others handling absences associated with COVID? Still not implementing attendance policies, or are you returning to attendance policies now?
I'll just briefly mention that. Karen might want to as well, but actually 2020, we added 10 sick days to everyone's available time, just because we wanted to make sure that people that were symptomatic did not come into work. And by giving them extra sick time, we thought that would help. So many people were able to roll that into the next year. So we have been, I haven't had anyone have to go unpaid. They've been using sick time for that.
Any other questions that anybody wants to throw out? I think that's good for now. Susan, thank you very much. We appreciate it. I know you've got some other commitments today, so if you need to slip out, just, please do, but I always appreciate your input. Karen Venus is up next. I mentioned that she's the CEO of Sayre Christian Village, 25 years in HR and now institutional leadership. You know what? She must have known this is a good job to move to, but she actually has an associate's degree in nursing from Midway University, and she has a bachelor in business from the University of Kentucky. So she's well educated for this job. Karen, what a wild ride you're having right now. Tell us what's going on.
First, thank you for having me today, Lyle, and I appreciate just everybody hearing us out for a few minutes. And Susan, you did a great job. As Lyle said, I currently serve as the CEO at Sayre Christian Village. If you're familiar with Lexington, you're probably familiar with Sayre. We're not affiliated with the school. We are a senior living community nestled here off of Tate behind Wilson Downing. We serve 420 current residents. We have the capacity to do more than that, but COVID has really taxed our resources. And so we never want to be in a position where we're going to compromise the quality of care or living that we provide based on the challenges that we're facing right now with staffing. As it relates to COVID and staffing issues, we're one of the most highly regulated industries out there. Next to a nuclear power plant, you're not going to find somebody, maybe banking, that's got more regulations than we do. But our job is a tough one because we have to keep people safe and we have to keep our most vulnerable safe. And so, as many of you know, when COVID hit, it hit our industry the hardest. And actually first, there was a facility out in the western part of the United States that had the very first outbreak, and Lord, we didn't want to be them. But, our challenge was there was a lot about COVID that we didn't know. Thankfully, 2 years into it, we're figuring and have figured out a lot more. I think for us, for staffing, it's very challenging right now, much more challenging than it was a year or even 2 years ago. I think for many of us, we were sought to be as heroes. We were the folks that never stopped being on the front line. We did not have the opportunity to work from home. Remote workforce for us is not possible when you're providing care to our elderly. And so our folks got through it with just adrenaline and passion, the passion for what they do. Today is a very different story in terms of staffing. It's just extremely challenging. In fact, I think about, we've had 2 outbreaks, one in our skilled nursing facility and one in our assisted living facility in October 2020 and January of 2021. And I thought I would never want to go through those things ever again. I'd almost rather go through an outbreak than have to deal with the challenges that we're dealing with staffing right now. And it's not unique to healthcare, certainly, and it's not unique to everyone, but it is critically challenging right now for us to hire and retain our nursing staff. They are tired, they're worn out, many are retiring, many are leaving the industry altogether, and many are not getting into the industry. And so it's become incredibly challenging, and we just have to continue to be creative on things that we can do that will recruit and retain folks to our industry, one that's already tired and known significantly for lower wages than traditional healthcare settings. But we are continuing to really just focus all of our efforts on recruitment. We're doing a lot of creative recruiting, things that we've never talked about in the HR world, but just trying to be very creative. And it seems to be working, but we've still got a long way to go. As far as masking goes, for us, masking is not optional. Regulatory wise, again, we don't have a choice. All of our staff and visitors are masked at all times. If you are a staff member that is unvaccinated or on the backside of your isolation period, you're in an N95 mask, or if we are in an outbreak situation, which we currently are in outbreak situations in 2 of our facilities. So everybody's in N95 masks. As far as testing goes, again, where we are very heavily regulated, our guidelines when we're in an outbreak situation with the positivity rate being at 32% or higher, whatever it is today, we are actually testing twice a week. We're doing PCR testing on Mondays and Thursdays. It takes an extremely large amount of resources to make it happen. We typically get our results back within 24 hours. We partner with the lab. They're right here on site. At one point, we were even doing drive-through testing for the community, but it got to be so crowded that our facility just couldn't handle it. So we had to discontinue that. But we are testing all unvaccinated staff twice a week, regardless. And then, of course, if we're in an outbreak situation, we're doing. It's hard to do contact tracing in our facility, so it's pretty much mass testing for all staff and all residents. And then depending on the outcome, depends on what our next testing cycle looks like. Vaccines, obviously that for us is a huge topic right now, as while the OSHA mandate is still up in the air, the CMS mandate is not. And so for us, there will be a mandate for our staff to be vaccinated. We've got about 83% of our staff that have at least one dose or are fully vaccinated, which for our industry is really, really a strong number. I'm proud of that. But we're continuing on education and just really trying really hard. Our challenge right now with the vaccine story is the folks that were hesitant before with Omicron are even more hesitant because they feel like the vaccine, you know, I'm sure you've all heard the arguments that are very compelling as to why you shouldn't, but we are focusing on our compliance to make sure that we either have 100% either fully vaccinated or have the medical or religious exemptions as according to the CMS mandate. And that, I believe, covers all your topics.
All right. Thank you, Karen. Any questions from the group out there? Aha, something just popped in here. And is somebody prepared to run these questions by her, or do you want to look at them yourself, Karen?
I'm reading the one. Hang on.
This one's basically asking any suggestions on how to do the testing, since I think it's talking about the test kits not being available and the costs associated with it.
Yeah.
So we are, for us, our testing is funded by the Department of Health and Human Services because of the population, but our community at large, our family members and family members of residents have had significant challenges right now finding access to testing. I know that last week there was, of course, the at-home, free at-home kits, test kits that you can acquire. As far as testing goes, what we have found is if you are in a situation where you're testing and you let that lab know that it is a result of a possible exposure, they have access to CARES money to fund those testing that way. What we are seeing not to be the case is if you're testing for travel, typically it's just more of a challenge. But we, if it can't be billed to our insurance, which we're not self-insured, so I can't answer that question, CARES funding is picking up the tab on the backside.
Well, okay. Thank you very much, Karen, for sharing this, and we'll keep you in our prayers. Boy, I know it's a challenge. So we appreciate you sharing that with us.
Thank you.
Well, we've got a lot more to cover today. You know what? I missed a slide earlier. I kind of went back quickly. The slide on the free COVID tests now available. There you go. Thanks for putting that back up for me. In case you don't have the notes on this, Karen mentioned this. Absolutely. Free COVID tests now available, and they'll send them to your house. And we don't know what's going to happen with the free masks available soon. Kind of interesting comment down there that some of the pharmaceuticals have said, see, they haven't announced where they're going to distribute those things. And some of the pharmacies are saying, wait a minute now, if we have to give away masks, how are we ever going to sell the ones we're trying to sell? So that's going to be an interesting little tidbit. But, you know, the government's trying to do their part to get those things out there. So I guess that's a good sign. Let's flip on down because we've got we asked Autumn to help out. A lot of you know Autumn Blakeman. She's a member of our team, and she actually runs all of our assessments and does a lot of analytics in HR to help our clients. And so she's going to cover a little bit about what is going on in Kentucky because the numbers are over the top. Autumn, take it away.
Sure. So I don't think any of us are a stranger to this map here. So this is back, jumping back to last January, I believe. Yeah, last January. As you can see, all red, all except for one county down in the west, but overall incidence rate of 81.4. So we were really in what we thought was the height of COVID at this time, but we jump forward to today. So here's today. As you can see, all red. Incident rate is almost 2 to 3 times more now. So we're at 237, and again, much higher than that 25, which makes you red in all of these counties. That being said, we're obviously operating in a completely different variant now, which is less severe but much more contagious. So just something to keep in mind when we're looking at this map. So, you know, the guidelines still say if there's more than a 10% positivity rate, you shouldn't travel there. But obviously we are far beyond that now, closer to 32% in Kentucky. So just a point that obviously the cases are skyrocketing right now, but we also need some changes and a fresh look on what this means in the future of COVID that we're going to be working in. Just because a 10% positivity rate doesn't seem like it's going to be realistic under this variant right now, or maybe anytime in the close future. And then you can also see Fayette County, Jefferson County here. Fayette's at 303 on their incidence rate. So just something to keep in mind, and we'll see if anything new comes out about guidelines. Jim, anything else that I didn't cover here that you want to mention?
Just one, just to show overall, one of the things that I think is going on, shared this beforehand, so please understand what I'm meaning by when I say this. I think the numbers are very skewed right now on the positivity rate, not artificial, but skewed, because if you remember back last year, everybody was getting tested all the time. I'm going to go to a birthday party, I'd go get tested before I went to the birthday party to make sure I didn't expose anybody. Well, the test kits aren't available now. You can't just go out and say, gee, I'm going to go get tested. Employers can't send everybody in to get tested every day and have that incidence rate percentage-wise be so low. Now the test kits are so unavailable that if you're going to get tested, either you've sat in line for 3 hours, which I had to do last week at Commonwealth Stadium to get tested, or you're positive because a doctor referred you to be tested because of your symptomology when you went into a clinic or the ER or an urgent care. So the positivity rate is artificially higher than it was a year ago because the test kits are no longer available. And so that's why we talk about how something needs to change here, because we're not really comparing apples to apples when everybody could get tested even if they didn't have any symptoms before, and now you can't even see the test kit. Like the speaker just indicated a little bit ago, I think Karen said that, you know, yeah, you can get tested unless it's travel or other things. Well, that back, you know, 6 months ago, a year ago, you could get tested without any problem whatsoever and really without much of a wait. So it's just a little bit of a misnomer to look at 32% and go, oh my gosh, we were at 3%, now we're at 32. Well, yeah, but you were at 3% because you could have 100 times more tests being delivered than you can right now.
A lot of people
they just aren't available. Huh?
I say a lot of people tested in the past just on the chance they might need it, but now
That's
those
correct.
people, they can't even. Yeah, it's people that are going in that really think they might absolutely have it now, and they do.
That's right, and yeah, that's the one thing I wanted to point out. The incidence rate, however, is not artificially increased, because the incidence rate is the number of people per 100,000 that test positive. So the number of people in Fayette County that test positive per 100,000 is 303 for every 100,000 people in Fayette County. Henderson is 389 for every 100,000 people. That's a large number, and that's the number that they watch that must stay under 25 to not be in a red county. So that would be the only thing I wanted to point out, Autumn. And I don't want anybody to suggest that or to think that I'm suggesting that these are fake. It's not that they're fake, it's that they are different. Because if test kits aren't available, then that percent number goes higher because it's the percent of test kits coming back positive.
Yeah.
If you reduce the number of test kits that are available, then obviously you're going to have a higher positivity rate.
So it's not like there's not a serious problem. This points out a serious problem. It's just not as easy to compare it to the past and get it, kind of accurate view.
That's correct, and that's what I wanted. That's what I want to share.
Yeah. Well, good input, Jim and Autumn. We really appreciate it. And now I'd like to introduce our next guest speaker. He's already started, but I may need to put this on just a moment here. Even though Zoom, our guest speaker, the great James M. Morris, has COVID, but he's decided to join us anyway. But he also has strep throat. He said the strep throat is much worse than the COVID. So he had to rush to get some medical attention last week because he was getting to where he couldn't breathe. So Jim, we're just glad you're back, that you're feeling better today. And it's interesting with Zoom, you can operate from anywhere, even if you're not feeling well. So we really appreciate you joining us today.
So I'm here at home, which is creating some issues for me on Zooms or on the, I don't have my setup at the office. So if it's been glitchy, I don't have my clicker. So I've been trying to do this with a mouse and it's been bouncing all over. So to the speakers, I apologize. I couldn't roll one slide. It kept going 10 slides at a time. So it was a little bit off. So a little further update, this was actually Saturday morning. Literally could not swallow, my windpipe was blocked. So they had to take me and give me some steroid shots and other things. And it was remarkable how quick it changed. And once that happened, I realized that COVID really didn't do anything to me. I don't mean that disrespectfully to COVID, knock on wood. It was all the strep issues that I was having, and it created substantial issues for me on that side. So I'm here. Hopefully you won't get it from me. If you do, it's not my fault because Zoom had the capability for me to be here, and you can sue them. If you need an attorney, let me know, and I can find one for you. All right, here we go. So the Supreme Court came out with some updates. There's also another update on the third mandate that we've talked about in the past. For those that haven't been with us, there are 3 different mandates that have been issued. One is the OSHA mandate for more than 100 employees. One is the CMS, Centers for Medicare and Medicaid Services, which was just briefly talked about by one of the speakers as well. And the third one is called the Safer Federal Workplace Task Force mandate, which was an executive order issued by the new administration, the Biden administration back in September area. So the first 2 of those were addressed by the Supreme Court, and I wanted to make sure you all understand what this truly means, because I think there's some misinformation out there. Everybody thinks that this is done. Oh, well, Supreme Court's ruled and this is all done. Not the case at all, and it's interesting because the way the media covered it, and I talked to Lyle about it last night, and I won't speak for him, but he sounded a little surprised as well. The Supreme Court did not rule on the merits of the case. Supreme Court issued a stay of enforcement, which is the same thing that the Fifth Circuit did. If you remember back in November, I pointed out Fifth Circuit, well, let's go back a year ago when they declared there was going to be an emergency temporary standard. I told you 1 year ago, almost to the day, no way this will ever happen. On the OSHA mandate, not the others, not CMS, not the federal government one, federal employer one, but I said the OSHA mandate would probably never be legal. If everybody listened to me a year ago, they would have saved a lot of legal expense and a lot of headache and a lot of other issues that have gone up through the Supreme Court, but nobody ever cares what I think. So what it is, the Fifth Circuit issued a stay. This all got consolidated in front of the Sixth Circuit, like I told you, which is Ohio, Kentucky, Michigan, and Tennessee. That court, in a split decision, number one, would not hear the case en banc, meaning all of the justices or all the judges of the Sixth Circuit. Only 3 judges ruled on it. 2 ruled that a mandate could go forward. 1 vehemently said that this is entirely absurd and it can't go forward. It went to the Supreme Court. It went to 1 justice, Justice Kavanaugh, who declined to hear it himself and put it in front of the full court. The full court heard it on January the 7th, but what they heard was the emergency stay of the mandate, not the underlying merits, because the underlying merits have never been heard. The only thing that was heard was whether a party would be likely to prevail in demonstrating that this should not be enforced. So the Supreme Court issued its ruling, and what it ruled was, first, on the OSHA one, mandate cannot affect. Fifth Circuit was reinstituted, the Sixth Circuit was thrown out. So the Baxter test mandate for the 100 employees or more is now set aside. In reinstituting the stay, Supreme Court talked about the outdoor exemption being illusory, meaning it basically didn't make sense. It didn't identify differences between different positions. Basically, no one could be an outdoor, because even if you're a landscaper, you would go into a shed to get a rake, then you're an indoor employee because you had to be inside, or you're in a truck, or you're in a enclosed environment to get your to clock in or clock out or anything. So they said it basically was a fake exemption for outdoor. They called it a blunt instrument. It made no distinctions between industries, between different levels and risks of exposure. And so the Supreme Court said too much. So that the petitioners would be likely to prevail, which is the standard on a temporary injunction, in showing that OSHA lacked authority to issue the mandate. Basically, OSHA is supposed to protect workplace. OSHA cannot protect against all potential hazards everywhere and anywhere unless the legislature gives them the opportunity. So what the Supreme Court did in a nutshell was it said first, that the ETS was not authorized by OSHA. It is a broad public health measure rather than an occupational safety and health standard. And it said the equities did not weigh in favor of leaving the ETS in place. It literally had a discussion about the government says that by doing this, it could save 5,000 lives. The employers talked about how this would cost them hundreds of billions of dollars. And the judicial system said, or the Supreme Court said, look, we're not saying which side's right. It's not for us to decide which side is right, because you're weighing 2 different issues, and you're also saying that we need to govern things outside the workplace, even though it may impact the workplace itself. And so that's what this weighed down to. It's not like asbestos, because asbestos would be in the workplace, you're breathing asbestos. It's not like black lung, which was the other ETS that I talked about in the past. There were 2 ETSs, asbestos and black lung. The only time you get black lung is in the coal mines. You don't get it at home and then possibly expose people. To do something like this could have been, and that's why I said a year ago, this cannot fly. You then can govern the flu. Well, then can you govern obesity? Can you govern off-the-job drinking in a job that doesn't matter whether you drink off the job? So this was a slippery slope issue that the Supreme Court had to say, you can't do things like this using a workplace standard for non-workplace issues, because then there's no stopping the authority. So that's that one. So then the question becomes, what happens now? This is temporary. This stay is not a full-on decision. This now goes back to the Sixth Circuit Court of Appeals. The Sixth Circuit Court of Appeals already rejected an en banc. Now, I don't know, and I could have researched this. I think that it can. I apologize, I didn't have the time. It was a little hectic weekend for me, but I did not research. I believe this now becomes a brand new case in front of the same 3 judges, but now the entire court can reconsider its en banc rejection that was a split decision right down the line last time, 8-8. They can now reconsider whether this should be reviewed on the merits, not on a temporary stay, and whether it should be the whole Sixth Circuit. But what's going to happen now is the Sixth Circuit will rule on all of these appeals across the entire country on the merits instead of on this emergency temporary stay. Then OSHA issued an announcement that, quite frankly, scares the heck out of me and should scare anyone that's on this call. And this is the reason why I wanted to have the call. I even sent an email to Lyle to see if we could do it last week. But with the decision coming out so late on Thursday, it was impossible to get the announcement in time. And also everybody had other things going on Monday, and it just didn't work. And it was a holiday and different things going on. OSHA issued what I can only call it a veiled threat. Actually, I can call it an outright threat. OSHA basically thumbed its nose to the Supreme Court. There's no other word for it. They literally said, I'm going to read it. OSHA will be, and I didn't put the whole thing on here. I mean, it was like a page and a half of, we don't care, you better protect your employees, we don't care, and we're going to do this. But these are the things that they said that you need to be listening to very carefully if you are governed, or you are governed by OSHA, to make sure you're protecting your employees. It says, and this is after the Supreme Court's ruling, OSHA will be evaluating all options to ensure workers are protected from this deadly virus. We urge all employers to require workers to get vaccinated or tested weekly to most effectively fight this deadly virus in the workplace. Employers are responsible for the safety of their workers on the job, and OSHA has comprehensive COVID-19 guidance to help them uphold their obligation. Regardless of the ultimate outcome of these proceedings, OSHA will do everything in its existing authority to hold businesses accountable for protecting workers, including under the COVID-19 National Emphasis Program, and this is the key, General Duty Clause. You've heard me talk about the General Duty Clause for a year, over a year. General Duty Clause is you have a general duty to protect your employees from a known risk or hazard, period, all. Whether they work remotely, in the office, whether they're outdoor, indoor, you have a duty to protect your employees from a known or reasonable risk of harm. The OSHA in this instance basically is saying we don't care what the Supreme Court has said. You have a general duty requirement to protect your employees. And we believe this is a known hazard and you should have done the things we told you to do. We're going to come after you to the best of our ability. That's kind of scary because that's basically saying we don't care what the court says. And that's why I wanted to make sure you all understand this fight's not over, because what they're going to do is they're going to fall back on, they also include the National Emphasis Program, which was the precursor, if you will, the thing that came before the ETS, because they couldn't get the ETS issued because it never made sense. It couldn't be law. They came out with this National Emphasis Program, basically an ETS that wasn't a full-blown emergency temporary standard. They intend to still enforce this and penalize people. And I didn't include a slide on this, but if you get a chance, you may want to look, because OSHA just announced the 2022 sanctions. They've increased by 6%. So $15,000 per occurrence, a little bit more than that. And if it's willful, it's $137,000 for a willful violation of any OSHA standard. I believe they're basically going to ignore the Supreme Court's ruling, ignore the Sixth Circuit's ruling, go after the General Duty Clause and start trying to chase people down, trying to scare you. But when I see this kind of announcement after a Supreme Court ruling, which usually everybody goes, yes, sir, sorry, we didn't do it the right way, we'll do it from here on out, to have them basically say we don't care what the Supreme Court did, a little surprising. They don't say that, but you can see right here when they say basically we're going to still enforce this under our other duties that we can. So this was my comment. Wow.
That's going to get interesting.
Sorry, I have to do. Huh?
That's going to get interesting.
Yep. So OSHA is still threatening to take action under the general duty clause despite the Supreme Court's ruling is what I put at the top there. That's kind of the headline. So what should you do? First, if you're in a state that requires employers to mandate, you have to still do that. That's not Kentucky. There are certain states that require people to continue to mandate vaccination or testing. You still have to do that. Second, if you're in a state like Florida or Texas that restricts the ability to impose, you can start complying with that state law. And the reason why I'm including all this is I understand almost everybody on here is in Kentucky, but I've gotten many questions from a lot of you that you're in multiple states.
Yeah.
You have to comply with each one of those states. And sometimes that means one is saying we no longer follow OSHA. Another is saying, oh, we don't only just follow it, we've now gone way beyond it. You have to make sure that you are complying with each one of those states' laws and make sure you're doing it appropriately. For everybody else, which is basically everybody on this webinar, I'll tell you what I shared back in November, which is you should have already established a philosophy on vaccine mandates. Now, this isn't for your CMS. If you're a medical facility, you don't have a choice, and we're going to talk about that here in a second. If you're a federal contractor, you don't have a choice either. Actually, you do have a choice, and it's a little all over the map. That one we're going to talk about last. If you're an employer with more than 100, you should have a philosophy on it because we talked about having that a long time ago. If you want to mandate, you can go ahead and move forward with appropriate accommodations for ADA and religious exemptions and so on. If you want to do that, you're free to do it. That's on you. If you want to do a vaccine test, you can do that. The problem with a vax and test, meaning for those that don't want to get vaccinated, you want to allow them to be able to get tested. They can't get test kits. Now, you can get the ones that Lyle talked about at the beginning, or the slide talked about, the government one. The interesting thing with that is each person can order 4, but they take 7 to 10 days. I don't know if that's been expedited any better than it was, but when it first came out, they said it would take 7 to 10 days to get your test kits. I don't know how many you're allowed to get. I don't know whether you're allowed to keep ordering. I don't know whether people in the same household can all use different ones and keep ordering to the same household. I haven't researched any of that, but the problem with any kind of requirement that your employees have to go get tested is unless you are going to give them the 4 hours to go get tested every single day, you're basically not able to get them tested every single day or every single week. Having gone through this last week 3 times, because I thought I didn't feel well, went to get tested, was negative, went to Dayton for a funeral and felt really bad, and went and got tested again and came back positive. Every time I go, 3 to 4 hours waiting in line to get tested is not feasible for an employer trying to get an employee to be tested for work purposes. So if you're going to do that, remember the lack of test kits currently available that will create speed bumps in trying to do the vaccination and testing combination. If you don't mandate,
Jim, I wonder if anybody on this call has gotten their test, because I was able to sign up for tests the day before the thing officially opened. The website seemed to work just fine. I'm just curious if anybody's gotten tests yet. If they are,
have you
put a note in.
Yours?
No, nothing
How
yet.
many
I'm
days
watching.
ago when did that open? Was that a week ago?
Yeah, it was about a week ago. Yeah.
Yeah. They said originally it was going to be a week to 10 days, and one of the comments back was, and again, this is just, I agreed with this. You can order through Amazon anything and basically get it next day. Now, I know the supply chain slowed that down somewhat. I don't know how in the world we couldn't get these delivered once they were supposedly available next day, when we can get anything we want on the internet next day delivery. It seemed kind of odd that the government couldn't pull strings to make or force Amazon, FedEx, UPS, whoever to deliver these things next day. Because if you need the test kits, it seems to me you would need them when you feel like you need them, not 7 or 10 days later when you're probably no longer positive.
Yeah, but none of the mail, I don't care who it's coming from, FedEx, UPS, or the U.S. mail is working properly right now. It's a big mess.
No, yeah, it all seems a little messed up, doesn't it?
Tasha Wright Underwood wrote that the website said they would be mailing them in late January before any of them were mailed out. So I hadn't seen that. But there you go. So I'm not going to hold my breath. I'll quit sending out by the mailbox every day. Waiting.
So the last bullet down here, or the second to last bullet, if you don't mandate, you need to take all precautionary measures to prevent the spread of COVID, because you do have the threat from OSHA that they're going to be looking into how people are making sure that people are not needlessly exposed. So make sure your hand washing stations, make sure you socially distance, make sure you're doing safeguards, keep people separate from one another. Go back to at home if you can, for those that can work from home. It's amazing that we seem to be in Groundhog Day. It's like the same day 2 years later from when we started this. We literally are coming up on, we're in the third year of COVID. Lyle and I have now done this program. In 1 month from now, that will be 2 full years of running this program. Almost weekly.
Angie, oh, sorry, go ahead. It was weekly for a long time, wasn't it?
Yes, it was. So then I wanted the last thing, don't distribute your ETS compliant written materials, but do hold on to those, because the Sixth Circuit is not going to be the final say. This will end up back in front of the Supreme Court regardless of how the Sixth Circuit rules. And you never know what's going to change between now and then. Just hold on to those materials regardless of where you were in the process, so that you can roll that out. Because what I've seen with the federal government right now is they're not giving you a lot of time to catch up and comply. And you'll see that with the CMS here in a minute. So
Jim,
speaking of the CMS, here you go.
So
if you're in the Medicare Medicaid field, anybody who gets reimbursement Medicare Medicaid, they lifted the stay on the CMS mandate, so it now became effective. It said, the Supreme Court said it did not exceed its authority in making mandatory vaccination a condition of participation in the Medicare Medicaid programs. It was not arbitrary and capricious. Its analysis and explanation demonstrates the agency acted within a zone of reasonableness. The winter flu season and potential for increased COVID infections, hospitalizations, and deaths is the something specific, quote unquote, that's required to establish good cause and forego notice and comment. CMS was not required to consult with appropriate state agencies, and it was not required to prepare regulatory impact analysis for the small facilities, country facilities, those types of things that are overly impacted by activities taken against hospitals. Your small, like Pikeville area, smaller town areas are drastically impacted more than large communities. Normally they have to do some kind of impact analysis study. Supreme Court said no, not in this instance, because there's an emergency here that has to be handled. Whoops. This is the bouncing around. Sorry about that. Supreme Court emphasized the need to promote and protect patient health and safety, and it said it would be antithetical to the whole purpose of the healthcare industry to have an unvaccinated healthcare worker that were to contract and then transmit COVID to the patients they were directed to and ethically required to protect from harm. So that's the basic analysis of it. So what does that mean? Well, on Friday, new guidelines came in. I want to make sure these were in here for anybody because a lot of you've asked me healthcare in the past, so I want to make sure this was in here. On Friday, the CMS issued brand new deadlines for everybody who was in an enjoined state. That was us. meaning we were limited. You did not have to comply with the CMS guidelines because of those 24. And now this shouldn't have said, or perhaps, because actually Texas reversed course yesterday. The court dismissed the case, and now it's Texas is now in line with the rest of the country. This is a nationwide enforcement. So, first one, February 14th, you must develop all policies and procedures, ensure all staff are vaccinated or have at least received one dose, have a pending request for it, or have been granted an exemption. Phase 2, 1 month later, or 4 weeks later, you must have the same policies, blah, 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 and they must have received all necessary doses, have been granted a qualifying exemption. Otherwise, the facility will not be considered compliant. A non-compliant facility will not be subjected to enforcement action if it's 90% compliant and it has a plan to achieve 100% compliance within 30 days. The last one, I kind of short shrifted it because it literally was the same exact thing over and over and over again. And then it said, but you must be 100% compliant. So if you're in this, you should already know this. If you don't know this, you need to get on the ball and start doing it. So if you're a CMS governed, mandate governed entity, the new deadline, February 14th, March 15th, April 14th. Get compliance done so that you don't end up on the wrong side of that, because it's going to kind of be ugly if you are. All right, the last one. We've talked about this many times. I'm not going to waste much time on it, but the federal contractor mandate, there was a 14042 and a 14043. I decided not to list both of them, but the Eastern District of Kentucky was one of the first ones to issue a preliminary injunction for the 4 states. Actually did it for 3 because Michigan wouldn't join. Kentucky, Ohio, and Tennessee had enjoined the federal contractor limitations. 11th Circuit rejected the administration's request to lift the stay. On Friday, another federal court issued yet another stay, and this time it said so nationwide. The government has come out, federal government has said that it will not enforce this until it gets full clarity from the Supreme Court. So the executive order mandates are continuing to be addressed. They continue to be in limbo, and we'll just have to wait to see what happens next. I was actually a little surprised at Friday's ruling, not because it's any different than the other ones that have been issued, but if the federal government, if the Supreme Court's ruled that the federal government has the ability in a CMS situation to require a mandate, I don't know why they would consider that the federal government couldn't do the same thing on an executive order. I've heard several legal authorities say the same thing, that this kind of surprised them because they kind of thought this one would die on the vine and would become enforceable simply because of the Supreme Court's ruling on the CMS. I know the CMS had some medical and this one doesn't, but the analysis was different because the federal government can control things that it allows people to participate in. Well, that's the same thing as a federal contractor. The federal government's allowing you to participate, so it should be allowed to control things. Whether you agree or disagree with that, that's kind of what the Supreme Court came down on. So I was a little surprised to see this new ruling, but that's where it is. Everything so far has said it's not enforceable. So stand by if you're a federal contractor. So that's it. I'll answer whatever questions we can find. I'm putting the codes on the screen and let's roll.
Hey, Jim, a couple of people mentioned, Angie Forrester said that she actually was able to order tests last week through Anthem and I've lost the spot now, but a gov.covid site, and she got them. She's already gotten the test. So that's interesting. Somebody else said that they found them at Sam's, but they weren't in, but they say they're coming in later this week. So I think that's what they were saying.
Yeah, well, I'll tell you, this is going to sound really bizarre, but Speedway has them.
Speedway has them?
Yeah.
Wow.
They're behind the counter. You have to ask for them, but Speedway has them. Now I think you have to pay for those regular. I don't think there's any like, hey, hand me a free box, but yeah, I don't know.
How about
Yeah,
this?
it's bizarre who has them, because I guess it's where are you asking for them? If you go to a pharmacy, they're sold out. You can't
Yeah.
get them because everybody's going to the pharmacy.
Well,
I don't
we
know
need to
how
find
Speedway got them, but Speedway has them, and that's my son last week when I had my first at home. Like I said, I went through the drive-through a couple of times, but the at-home test, the first one I got, my son went and got it for me. The only place you could find it was Speedway.
That's interesting. So Kimberly Harpole, we need to find out who her insurance company is, because she said she couldn't get them from the government, but her insurance company sent 4 free per household member on their health insurance policy.
Wow.
That's a lot of tests that come piling in, I guess. I don't know how big her company is, but if you want to clarify that, that'd be very interesting.
So let me see here. I'm going to try to read some of these questions, or well, I'll tell you what, if anybody else has marked those down, why don't we roll through those questions?
Okay.
I do have a private one to me. Somebody asked, does the fact that Kentucky has its own state OSHA plan impact OSHA's stance? The answer is no. OSHA believes that it controls everything. The states are on top of, can be above OSHA, but not below OSHA. Other states have said that they're not following OSHA at all, like Florida just adopted to reject OSHA altogether. But Kentucky does not do that. So we would need to comply with both Kentucky and federal, but Kentucky doesn't have a COVID specific OSHA difference from federal that I'm aware of.
Yeah. Looks like Anthem.
I got another. Sorry, go ahead.
I would just say, it looks like Anthem, I'm just reading on down here, must be providing tests for people in your household. So if you have Anthem insurance, you might want to reach out to them. Go ahead. You got another question?
I had another private, and then we can get to any that
Okay.
Autumn or Chase or Allison have seen, and they can ask me and I'll answer them. But I have a private one asking if I have any inkling if the new OSHA push will apply to all employers, including those under 100. I think that OSHA already got slapped down by just doing the mandate that they just tried to do for over 100. If they do it for under 100, the cost would be exponentially higher because it impacts those smaller businesses even more. So I think they're going to have difficulty if they tried to reduce the number of employees down to a lower number. I don't suspect that's going to be one of the issues. I do think that they're going to try to do some more things. I don't know yet what that means. But their comment on their website lets me know that they're not done fighting this. So what questions does anybody else have?
So we have a couple here, but I'm not sure. I think your answer might be that they need to check with their own counsel. Because one of these is, if your fire department through EMS payments receives Medicare and Medicaid payments, does that subject the fire department to follow I think they meant CMS, to follow this and the city as a whole?
I'm pretty sure, and I don't know this because I probably shouldn't speak on it, but I would say that if the fire department's receiving CMS money, the fire department is obligated. I don't believe the city as a whole will be obligated, because the city as a whole would be separate with regard to receiving the CMS. I think that those are usually broken out by the actual the fire department itself is the one that receives those monies, not the whole city budget. But you probably would need to verify with your city legal counsel to make sure that's accurate.
And then is Ohio one of the states? Oh, sorry.
I was going to say, I just saw that one. I do not know. I have not researched. None of my clients in Ohio have asked me to do anything with the vaccine or the testing. So I don't know about Ohio. I'm sorry.
Well, good, and that looks to be all of the questions that are meant for you. Some of them are people sharing things that they're doing or places to get tests. So if anyone's interested, be sure to check out the chat. There's some good info there, but no other questions for you.
I can say there was a comment asked about reimbursement. My understanding is the federal government is going to allow for reimbursement for buying tests because they were a little bit lax in October in deciding we no longer needed test kits. They literally said that they would allow for a reimbursement. I don't know how they're going to do that. I don't know whether it's going to be on like your tax returns where you can just say, here's a receipt for test kits that I had to buy because you didn't make them available. I don't know. But they did say that during one of his press conferences, or during one of their press conferences, they said that people who bought test kits would be able to get reimbursed for the cost of those test kits. I don't know how they plan on tracking that, so you'll have to just wait to see. Is that it?
Looks
That's
like
all
a
I've
lot,
got.
a lot of people back and forth on these different ways to get the tests. Or Target seems to have them for $7.99. I don't know if they have them now, but quick advertisement.
Well, thanks for everybody. I wanted to just say, and I'm going to take this off the screen. I know that Lyle likes me to stop sharing at some point so you can see everybody. Thank you for bearing with me. No clicker, the mouse didn't work right. Things were kind of a little glitchy for me, and so I appreciate everybody's patience today.
We're glad you're feeling better.
Yeah, me too.
I'll put those SHRM numbers in the chat box just so people can have them if they want them.